welcome to Spear Medical Education's Anatomy 101. So this is our series where we're trying to introduce basic anatomy and physiology concepts and lay those foundations for you to start building upon. What we're looking at today is key anatomical terms. So this is language or sort of written words that you will come across the more you begin to practice sort of pre-hospital care or emergency care. Or that you will come across as you're reading sort of books around the subject or watching videos around the subjects. What we're trying to do today is explain some of these key anatomical terms. And like I said, it's kind of like a new language, and it is a little bit difficult to get your head around, but the more you use it, actually, the easier it becomes, like most other things. So without further ado, I'm going to introduce you to some directional terms or some placement terms. So these are words that describe whereabouts on the human body the location of something is. And I'm going to tie this. I'm going to introduce the words, and then I'm going to tie it into a bit of an example in a moment to try and sort of make a bit more sense of it. So the first word we've got is the word superior. So superior means above the point that we're referring to. So if I was to describe where the shoulder is in relation to the elbow, I would say that the shoulder can be found superior to the elbow. Or if I was going to say, if you asked me where a person's elbow is, I might describe it as their elbow is superior to their wrist. So it's above something. You've then got inferior, which is exactly the same, but in reverse. It's below the point referred to. So another way that I might describe the location of a person's wrist is that the wrist is found inferior to the elbow. We've then got lateral, which means away from the midline. So if you draw a line straight down the centre of the human body, straight down the middle of the chest, if I was going to try and describe where a stab wound was, for example, I could say that the person's been stabbed in the chest, and it's lateral on the lateral side of the chest, or it's lateral to the centre of the chest. So it's away from the midline. I then could use the opposite term, which is medial, which is towards the midline. So the patient's been stabbed in the chest towards the medial aspect. That would send alarm bells ringing, because as we know, the heart and the aorta and other sort of big blood vessels are found towards the midline of the chest. We've then got posterior, which is towards the back or behind. So your back is your posterior side. But if we were trying to describe something that was moving towards your back, then we would describe it as posterior. We've then got the opposite of that, which is anterior, which is towards the front or the front. So the anterior aspect of the chest, for example, would be describing the front of the chest. We've then got the word proximal, which means nearer to the point of attachment. So that is closer to something than it is further away from something. So the way we'd use proximal, for example, is a broken bone with the bone sticking out of the skin proximal to the elbow. So that would tell somebody that it's higher up the arm than lower down the arm. And then finally, the opposite of that is distal, which is further from the point of attachment. So again, if we were trying to describe a broken bone that was along the length of your lower arm, then we could use distal to say that the injury is distal from the elbow, but say proximal to the wrist, and that would tell you that it's the lower part. We could then combine that sort of further with some of the other language we've used and say the fracture is distal from the elbow but proximal to the wrist, and the bone is protruding from the skin along the anterior aspect. So without somebody even seeing that patient, they're left under sort of no illusion as to whereabouts exactly that injury is. So if we look at this really badly drawn arm at the moment over here and tie that in a little bit more, if this is the anterior aspect of the arm, so remember that is the front aspect of the arm, and so that would be the palm of the hand. Have a look at this wound here. So this is a laceration to the patient's arm. Just have a little think for a moment how you would describe whereabouts that injury is. So for me, I'd be describing this as a laceration on the anterior aspect of the arm, and it's actually the lower arm, we could say, and we could describe that as proximal to the wrist and think about what it's distal from. So it'd be distal, so further away from the elbow. So without the person you're speaking to even seeing that injury or that patient, they can have a really good idea as to where that injury is. So you might think, what's the point? Well, if we're handing a patient over to the next level of care, whether that's to an ambulance paramedic or whether that's you're a ambulance crew handing it over to hospital, then actually this wound will probably be bandaged up. Without having to remove that bandage, they have a good idea whereabouts on the arm that is, and combined with your description of the depth of the injury and how that injury occurred, can allow them to start predicting what structures might be affected, so what nerves or ligament or tendon sort of structures might be affected, and whether they need to get sort of specialist individuals involved with this patient's care. So that's how we describe them, and like I said, we'd document them the same way. So when we're writing our patient documentation, we'd write it much the same way. So the next thing I just want to have a look at with you is another sort of surface anatomical term, and that is actually looking at the abdomen. So looking at parts of the abdomen and sort of what how we break down the abdomen, basically. So how we look at the abdomen and how we decide whereabouts on a person's tummy an injury is. So if this is the abdomen and we've got our belly button there, we then break that down into 9 quadrants. So again, let's use some of the language that we've been learning already, that this is the anterior aspect of the abdomen. So it's the front, and this is the left side, and this is the right side of the abdomen. So again, someone's been stabbed in the tummy, we need to be able to sort of describe whereabouts that stab wound is, because being stabbed in the stomach isn't good enough, really. We know that using our knowledge of anatomy and physiology, that behind each of the, or a bit behind the skin, but in the abdomen, there's lots and lots of different organs in there, and some of them we'd be more concerned about than others if they were subject to either an injury like a stabbing, or whether you had a patient that was presenting with new pain in that area. So rather than just saying they're being stabbed in the tummy or they've got tummy pain, we're going to start trying to break down whereabouts in the tummy it is. And we do that by first of all breaking it down into 9 quadrants, and then each of these 9 quadrants has its own name, which I will show you now. So first of all, we start off up here with the hypochondrium, and down here with the iliac region. And then in the middle is lumbar. Now actually on the other side it's exactly the same, but as you can probably guess, all we do is use the sort of pre-word left or right before it. So we've got the hypochondrium again, the lumbar again, and the iliac region again. So in this case, this patient's been stabbed in the right hypochondrium, or the right hypochondrial region. We then need to be able to describe what's going down the centre of the abdomen. So we start off with epigastric. We've then got the umbilical region, which is a nice easy one to remember because that's where your belly button is. And then we've got the hypo, or lower gastric region. So actually, that turns our description of the tummy, or the person's got pain in their stomach, or they've been stabbed in the stomach, or they've been kicked in the stomach, or they've got bruising appearing on the stomach, whatever it is, this allows us to actually narrow that down to a very specific region of the abdomen. And again, at this stage, it may or may not mean something to you, what we're describing. So it may not, you might not be comfortable with what's behind where these injuries might be, but eventually over time, as you develop your understanding of the abdominal anatomy of a human, and actually what all of those organs do and their sort of relevance to normal physiology, then actually you'll start to be able to predict the severity of injury or the potential diagnosis of sort of whereabouts that injury or whereabouts that pain is presenting. At this stage, if you could learn all 9 of these quadrants, and then be able to, or 9 of these sections of the abdomen, and be able to document that or hand that over to somebody that it means more to, as in they can start to form a diagnosis or predict injury patterns, then that's a really, really great start. But like I said, over time, you'll be able to start doing that yourself as well. So thank you very much for listening. I hope you found this helpful. Please give us a like and subscribe. Please give us a share to sort of any student channels that you know, or sort of social media pages where other students are sort of learning this stuff. And we'll keep producing content and trying to help you guys out. Thank you very much.